breast cancer, causes, symptoms and treatment. Breast cancer is a malignant growth that begins in the tissues of the breast. Over the course of a lifetime, 1 in 8 women will be diagnosed with breast cancer. Breast cancer is a cancer of the breast tissue, which can occur in both women and men. Breast cancer may be one of the oldest known forms of cancer tumors in humans. Worldwide, breast cancer is the 5th most common cause of cancer death. Breast cancer kills more women in the United States than any cancer except lung cancer. Breast cancer can also occur in men, although it rarely does. Experts predict 178,000 women and 2,000 men will develop breast cancer in the United States. There are several different types of breast cancer. First is ductal carcinoma, begins in the cells lining the ducts that bring milk to the nipple and accounts for more than 75% of breast cancers. Some women have what is known as HER2-positive breast cancer. HER2, short for human epidermal growth factor receptor 2, is a gene that helps control cell growth, division, and repair. When cells have too many copies of this gene, cell growth speeds up. Causes of breast cancer. Simply being a woman is the main risk for breast cancer. While men can also get the disease, it is about 100 times more common in women than in men. The chance of getting breast cancer goes up as a woman gets older. The most common gene changes are those of the BRCA1 and BRCA2 genes. Breast cancer risk is higher among women whose close blood relatives have this disease. The relatives can be from either the mother's or father's side of the family. Woman with cancer in one breast has a greater chance of getting a new cancer in the other breast or in another part of the same breast. Some pregnant women were given the drug DES because it was thought to lower their chances of losing the baby. Recent studies have shown that these women have a slightly increased risk of getting breast cancer. Use of alcohol is clearly linked to a slightly increased risk of getting breast cancer. Women who have 1 drink a day have a very small increased risk. Also, the risk seems to be higher if the extra fat is in the waist area. Breastfeeding and pregnancy. Some studies have shown that breastfeeding slightly lowers breast cancer risk, especially if the breastfeeding lasts 1 to 2 years. This could be because breastfeeding lowers a woman's total number of menstrual periods, as does pregnancy. Women who began having periods early or who went through the change of life after the age of 55 have a slightly increased risk of breast cancer. Symptoms of breast cancer. 1 lumps. 2 rash. 3 breast pain. 4 cysts. 5 nipple discharge. 6 inverted nipple, treatment of breast cancer. 1 hormonal therapy. 2 chemotherapy. 3 radiotherapy. 4 surgery.